Hello, I'm Jawad Husain, Executive Medical Director at East Lancs Hospital NHS Trust. This is my update on the 18th of March 2021. So I'll begin with, again, running through some numbers. Reassuringly, the infection rate in the communities is reducing, and that proportionately reflects in the reduced number of admissions in our hospital. So as things stand as of today, the positive rate of people who test at the centres is as follows. Blackburn with Darwin, we have got 100 people testing positive for COVID-19 per 100,000. Burnley is 72, Hyndburn is 64, Pendle 59, Ribble Valley 94, and Rossendale 101. These numbers are definitely lower than what they were a couple of weeks ago and last week, and reassuringly it is also showing a reduction in the number of people who are 60 plus turning positive. So it's very encouraging, and as I said, it reflects on the number of COVID positive patients in our hospital. So as of today, there are 29 patients who are COVID positive admitted in our hospitals. Again, proportionately, the number of people being admitted to intensive care is also reduced. This morning, there were only 6 patients who were positive with COVID virus and were in intensive care. So all in all, it is good news. It is also having a reduction of the COVID wards that we have. So in Blackburn, we have 2 wards which basically cater for COVID patients, and in Burnley General Hospital we have 1. These number of wards have reduced substantially as compared to the beginning of the 3rd wave. Now, all this is down to, again, people abiding by the rules, which is to do with hands, face and space, and it also to do with the uptake of vaccination, because what we have seen in the last few weeks is that our population, our patients who were elderly, their number of admissions have reduced to hospital. Partly it is down to the vaccination process which started in December. So my plea is to continue with uptake of vaccination. You probably are hearing a lot of news about Astra Zeneca in particular. Please be assured that it is a very safe vaccine. The incidence of blood clots is no different to people who receive or who don't receive the vaccine. Please don't go by what is being said on Facebook or other social media, WhatsApp, Instagram, whatnot. Do follow what Public Health England, NHS England and your local hospital and scientists are telling you. There is no more incidence of blood clots in general population who have taken vaccine to ones who haven't. So it is a safe vaccine. And the other thing I again want to emphasize is there is still a lot of talk about vaccines having an effect on fertility. Please be assured that it is not the case. Recently, Tolly Onon, who is a medical director at Manchester Foundation Trust, has also done a video. She's an obstetrician and gynecologist, but also a person who did her research in vaccines. And there isn't any detrimental effect of vaccine on fertility. So please continue to do the right thing. And if you have been asked to come and have the vaccine, please do so, because recently we are hearing and seeing that people who have previously booked in their appointments for vaccinations are not turning up. COVID causes far more danger to your life than what is being said out there about the side effects, but nothing that should prevent you from taking up the vaccine. So it's a plea to all that if you have been asked to turn up for your vaccine, please do so. And if you do have any questions, discuss it with your general practitioner. There are frequently asked questions on various websites, including our websites. You can access that and get any clarification. In regards to vaccine and moving on, although vaccine will prevent people having from severe disease and hopefully avoid hospital admission, but it's not a substitute to good hand hygiene, wearing a mask and social distancing. We unfortunately are seeing lapses in where people are becoming possibly a bit more relaxed than they should. We are still not out of the woods in regards to the infection and its transmission. So please abide by what has been said constantly on all the forums, that good hand hygiene, wear the mask and keep your social distance. Research, as I've mentioned in the past, is very important in progress of medicine and how we invent novel therapies. It was quite reassuring to hear that at East Lancs Hospital Trust we have recruited 6,000 patients as a part of various research projects to do with COVID. So again, the plea is that if you or your loved ones are approached to take part and participate in a research project, then going through what it entails, do come forward in participation, because the more we learn about this disease, the more we can devise novel treatments. And finally, the message is that the hospital is open for business. It is a safe place. However, it is also important that you attend the hospital for the right reasons. A&E is getting quite busy. There are alternatives out there, the services like 111, access to the GP and other community services which may help delivering the right care for you outside the hospital setting. So before you think of coming to A&E, do explore the alternatives which are out there and which may be far more effective with your time and the advice it provides. We'll meet again next time and I'll update you with all that is happening in hospital and around it. Bye for now.